It's such a privilege to work with you and you know, to see reflected in this hall today, you know, all of the community that you and your foundation board are engaging, you know, to support our healthcare system, which is so critical. I just want to say it's a huge privilege for me to serve as the chair of Vancouver Coastal Health. And before we go any further, I just do want to acknowledge that we're on the unceded territory of the Musqueam Nation. And in this year, our years of reconciliation, it's very, very important for us to acknowledge these things. I thought today that I could just give you a little bit of a reflection of, you know, really take a pause and as we're working together to, you know, bring some new life to the Richmond Hospital and your new capital project, just to really think back about how things have changed. As Natalie said, I've spent 45 years in healthcare, and when you think of it, the North Tower of this hospital was built just over 50 years ago. So in a period of time shorter than the life of that piece of infrastructure, here's the kinds of things that have happened. I was trained as a hematologist, that's a blood doctor, and when I started my career in the late 1970s, you know, treating leukemia with the little exception of small children was really an exercise in giving people a few more months. And in 1985, we did the first bone marrow transplant in British Columbia in the Vancouver General in the old Children's Health Center. And I was the fellow in training at that time in hematology. Think of what has happened since then. In those days, patients came in and spent 100 days in the hospital. That was just standard. And nowadays, you can have a bone marrow transplant and you can be home in, you know, 2 to 3 weeks or less. The first CAT scan in the whole of Canada was 1973. It was brought into the Montreal Neurological Institute. And I remember the first fax that we ever had at the time I was working in the Red Cross. Cataract surgery, 5 to 6 days in hospital when I was in training. Remember, for those of you who've ever seen anyone who's had cataracts in those days, they would have the big bandages on their eyes and they'd walk around the ward for 5 or 6 days before they were allowed to go home. And now, who's had a cataract operation? Like, how long does it take? About 5 minutes. So, you know, with these kinds of things, the drugs that have transformed, you know, our lives and our hospitals. If you think of friends and family who've had things like rheumatoid arthritis, some of our new drugs have absolutely transformed a disease that was just crippling. If you look at our lab devices where we can take a little spot of blood from you and measure your DNA. And look into vast data banks and understand what that DNA is telling us. Diagnostic imaging, for anybody who remembers what it was like to have a heart valve replaced, a life-threatening procedure, and now we can do it through a little fiber that we put into one of our arteries back into the heart, and you can replace the aortic valve, you can replace the mitral valve. Like, it is miraculous, and you think about that change that's occurred over my whole career. It's really absolutely fantastic. I had a friend the other day who has a lung cancer, and normally they would have a thoracotomy, which is, you know, a massive big incision comes around the chest. She had what we call minimally invasive surgery and had her cancer removed, had a lobe of her left lung removed, and she was out of the hospital in 5 days. It's like unbelievable. So I think the point here is that this is a field. We're in a field that's incredibly exciting. It's, as you know, as providers and institutions, it's so exciting to be able to change the outcomes and people's lives with all of these advances we have. And as we look at, you know, rejuvenating the capital infrastructure that we have across this country, in this province, in this city, it's really important that we actually, when we look at the curve of change, we understand what it is, what is healthcare going to be looking at in 5 years, 10 years, 20 years. And, you know, for the board of Vancouver Coastal, this is a project the replacement of your North Tower is a very, very high priority for our health authority, and we want to make sure that we are building for the future and for the kinds of opportunities and innovations that Richmond Hospital is going to want to have to serve you, the community. It needs to be forward-looking, and we need to, make sure that it's going to respond to the incredible growth you're having in your community. I think Richmond is bound to grow by 23% by 2030. Like that's a massive increase over 10 years in your community. Your senior population is going to go up by 120%. So when you think of the different investments that we're making in primary care, in ambulatory care, we have to make sure our hospital is ready. And, in terms of looking at the project and the business plan that we have underway, we want to make sure we get it right. You have an emergency department that is, overflowing. We know that imaging technology is used by 90% of the people that come into this hospital have to go to diagnostic imaging, X-ray or ultrasound or CT scan or MRI. And all of these things come together, and that's what we're doing as we look at getting this business plan ready to take it to government and get the final approval and then get the shovels in the ground. I'm looking at you, Teresa. So I want you to know that understanding the progress and the things that are happening in healthcare on an increasingly steep curve is a major consideration for all of you who are such generous donors to make sure that we've got the right outlook and we know what we're building and that it's going to sustain this community for many years to come. So what is in the future? Like I've already described what's happened in the last 25 years or 45 years, but if you, as a deputy minister, here's what you have to do. You have to take a step back and think, okay, so what's happening to our population? Well, it's growing, it's aging, but I'd just like to say, this year will be my 70th birthday. Hard to believe, eh? Okay. But we're aging, but we have higher expectations of both, what we're going to be able to do as we age and also what our healthcare system is going to be able to do for us. And, having our joints replaced is starting to be kind of the norm. I was having my hair cut the other day, and this young woman who's been cutting my hair for years says to me, well, doesn't everyone have cataracts, Penny? And I was like, well, not really, no. Oh, she said, I thought everyone had cataracts. And I was like, no, not necessarily. But we know that as we age and as we're able to overcome, illnesses that in the old days probably would have taken our lives, our needs for healthcare get more complex. And, sustaining us in healthy lives, making sure that the diverse population we have in our country and in this community is well served. We know that this is a global situation that we're in where Canada is going to continue to have immigrants come into our country to help support our economy and help build our population. We know that there are millions and millions of refugees on the move in our country, in our world, and we have to help, address some of those issues. All of these things start to, translate into what is our health care system going to need. And then we have things like climate change. We have our rural and remote communities that are in some cases getting smaller and a challenge to support. And all these things are things that you have to look at sort of at the population level. And then if you look at, well, what's technology doing for us? Well, one of the most important things that's happening that we really have to think about as we design our new facilities is artificial intelligence. Now, I have a lot of people that say that I'll be replaced by artificial intelligence, and I say bring it on. Bring it on, because then I'll be able to spend the year skiing and, sailing across Burrard Inlet. But I think the really incredible thing is that artificial intelligence, whether it's hooked up to robotics in surgery, diagnostic imaging, just decision-making is going to transform our healthcare system. And it's going to allow us to do things that, even at this point, we can't really imagine what it's going to look like. And we know that hospitals are going to be more and more complex in what they do. And, over my lifetime, what used to be an average length of stay in a hospital of probably 8 to 9 days is going to continue to come down. Just like my friend who went home after, 5 days having had half of her left lung removed. So, these are the fancy things. And on the other side is what we refer to as primary care. And I think in Canada, across the board, including this province, we've not done a terrific job in primary care. And I just want to acknowledge that the recent investments by our government in primary care is really, really, really important. And I think there's probably a number of people in this room that may not have a family doctor. And it's a very unnerving thing not to have a family doctor, because they're the foundation of our access to the healthcare system and also, our care along our lifespan. And so, trying to build primary care, it's not very fancy. It's not got massive amounts of technology, but it's really, really important. And we want to build an institution here that is so linked in to primary care and other parts of our community care that, patients will barely notice a difference as they move in and out of these different parts of the system. So I want to come back to, the whole issue of why I went into healthcare and, what it means to be a community. I think that, the art of healthcare is about compassion, and I worry that, our healthcare system will be digital and robotics, and, it will all be technology. And I think that, if you just read the Scientific American and even The Economist, that's kind of what you would think, that it's just all going to be we're going to come in here and there's going to be a robot greeting you at the door and, a robotic nurse taking you to your bed. But I just want to tell you that creating physical environments for our staff who are an absolutely fundamental part of healing and bringing people with all the technology that they're going to have access to back to a healthy life is absolutely fundamental. And we have to remember as we design our infrastructure that our staff need to work there. They work long hours. We need to build facilities that allow them to do their job easily, and the patients flow readily and the staff are there to receive them. Because I think for all of you who've ever spent any time in a hospital, it's the nurse's touch that is there 24 hours a day, and the caring and compassion and the help that we get from social workers, physiotherapists, occupational therapists, and our physicians. Those are the things that really do you remember. You don't so much remember the technology, you do remember the people. And so the other thing that we were spending some time on, and this is something that's right across the country, is how do we build institutions that are really great places for our people to work in, our patients to be in, and for their families to be there. And because we know that having your family with you when you're experiencing a healthcare issue is absolutely critically important. And we need to build facilities where families can sit and be with their loved ones and provide the comfort and the hope that's so important. So I think that having a community like this, I always get a bit choked up when I come to Richmond. I've spent many years in the city of Vancouver, which is a wonderful place, and I actually had a part in helping to run the city of Vancouver. But I'll tell you, when you come here, it kind of feels like a smaller, more tight community. And this is the second time I've had the privilege of being here and talking to so many of you who are such incredibly generous donors. And it is so important. And through your generosity, you actually inspire all of us at the governance level, certainly all of our staff. And it is part of the healing process, is to have a community that shows that it cares enough that it's going to contribute in many ways. And many of you, I've talked to many of the donors tonight, and many of you have made donations that are very, very significant for you in your position at this time in your different lives. And I think that there's no greater contribution than you can make. And I think the other thing is that we need community to help us solve problems. Like when you're in healthcare, the problems that we have are difficult and they're complicated. We look at mental health and addictions. These are very difficult problems and they can't be solved just by the healthcare system. We need community to help us, contribute to building facilities that are welcoming and appropriate environments. We need community to offer other resources and just community to provide support to people who have these different health challenges and help them get on the road to recovery. So I just want to say that it's really an incredible privilege for me to be here tonight, to be part of a recognition ceremony for the donors to the Acute Care Tower project, and to tell you that we're on our way. We've still got some work to do, but we are going to see this project and this new life be brought into this institution on this site. And I think there will continue to be things changing on this site and being invested in over many years to come. And this is a hospital that is absolutely vital and crucial to your community. So I just want to thank you, and I want to say that we're going to stay with all of you for a long time, and we need your participation, we need your commitment, and on behalf of the board of Vancouver Coastal and the whole organization, I just want to say that Richmond is a fundamental, crucial part of our health authority and the services it provides. It's a leader in many ways, and we're very privileged to be here. So thank you so much.